All right, today let's talk about 4 physical therapy myths. We're going to talk about several different things. The fourth one is the most important and will probably surprise you. The first myth is I want to talk about foam rollers. I like using them a lot to get joints moving. The bigger ones are better in my opinion. These hollow ones can be easier to control. But what I really like using it for is that mobility. If you're trying to get your spine moving or something, if you want to massage a sore muscle, then get a lacrosse ball, get a tennis ball, get a massage gun, use something that's more targeted so you can hit where you're sore. Or even if you need something more aggressive, then go get a massage from a massage therapist. Number 2, the second myth is that stretching is a great way to lengthen your muscles. There is a concept that muscles adapt to whatever load is put on it. So if you're going to stretch out your muscles every day, 4 or 5 times a day, they can become longer because you're putting them in a longer position more often. This is a really good thing in general because you need mobility, but you need just as much strength to support that mobility. So if you are stretching and holding it for a long period of time, the muscle can elongate, but it's going to recoil and come right back. But if you do it often, that's when you're going to see more of a difference. And the research shows that if it's held for 30 seconds, you get the most benefit. Up to 60 seconds, it's about the same. Beyond 60 seconds, there's no added benefit. So doing short and frequent stretching can elongate that muscle if you're doing it often enough. But the best thing to elongate a muscle is actually using that muscle through the range of motion. My favorite example is if somebody is doing bicep curls. I've seen this a ton. I go to the gym and these guys want really big biceps. Maybe they pop out a lot. So they take the dumbbells or a bar and they just do it from here up. And they're just focusing here. And sometimes you'll focus here and then focus down here, and that's okay. But they never go down here. They just focus up here, and then they walk out of the gym holding their arms like this. They can't fully extend them anymore because they put the muscle on a short position. If you sit at a desk all day for work and you never get up and take breaks, you're supposed to get up every hour. We have a whole nother video on stretches and movements, breaks to take when you're sitting at a desk every hour to rest your eyes and to stretch out your back and your hips. But if you're sitting at a desk for 8 hours a day, then your hip flexors are going to get shorter because they're put on a short position. And that shorter hip flexor will actually pull on your low back and give you a bigger arch in your back and often causes back pain. So when you have back pain from sitting at a desk, sure, stretching and moving your back might help, but you got to make sure you work on your hips. Okay, the third myth of the day is that physical therapists are glorified personal trainers. Man, this is a pet peeve of every single physical therapist out there. We are not personal trainers. Some of us have like CSCS or athletic training background. One of our therapists, Joseph, has a certification and license in athletic training. It's awesome. We understand a lot of those same concepts, but that is not our profession. That's not what we do. We are actually doctors. So I have a doctorate degree in physical therapy, and I am one of the top specialists in the healthcare field at assessing your injuries. So musculoskeletal and neuromuscular injuries is what we do. So when you go and see your primary care doctor, they're fantastic at internal medicine and they do a good job at general medicine overall, but there's no way they can know and specialize in everything. So they're going to know more about rashes, if you've got a cold, illnesses, kidney issues, things like that, medication. But if you have a musculoskeletal injury, you should be going to a physical therapist. This is a common thing with some other professions, even with surgeons or chiropractors. Some of them don't understand everything that we know and what we do. So if you look at the research, an orthopedic surgeon is the #1 best assessor for musculoskeletal conditions. So if you tear your ACL, orthopedic surgeon, top best, 84% accuracy compared to the gold standard, which is an MRI. A physical therapist is 83%. So we're almost as good as them. And then I won't go into the other percentages. I'm not trying to dog on any other profession. They each have their specialties. But just know a physical therapist is a specialty doctor in assessing musculoskeletal injuries. If you get hurt playing a sport or have a concussion injury, we're the ones that you're supposed to come and see. All right, the fourth myth, and probably the most surprising, is that you should rest until the pain goes away for any kind of injury that you get. And that is just not good advice. You may have heard that from different medical doctors or physical therapists. There's a lot of different opinions out there, but it really isn't good advice. Movement is the best medicine. Our bodies were made to move. There's a concept that maybe you guys have heard before, that an object in motion will remain in motion. So keep moving, because if you don't, you die. And I've worked with a lot of people who are 80, 90 years old and they've stopped moving and they just sit in a chair and they're like, why am I weak? Why am I falling? Why can't I do what I want to do? It's because they weren't moving. One of my favorite concepts when it comes to movement is when people talk about their metabolism. People say their metabolism stopped in their early 20s or slowed way down, right? That's not true. The research shows that it's actually 45, 50 years old when your metabolism starts to slow down. What you need to look at is how often and how much are you moving? What kind of movement are you doing? When I was in my early 20s, I played soccer 3 to 5 times a week for 3 or 4 hours, sometimes basketball. I was moving all the time. And then I stopped moving. I got into college and I was trying to start a career, and my metabolism slowed down, or so I thought. And that wasn't the case. It was just I wasn't moving as often. Brody, our marketer, you guys might know him, he runs all the time. And he's like 50 and I'm just kidding. Brody's actually still pretty young, but at 26 years old, he's doing great. His metabolism's not slowing down or feels like it's slowing down because he moves all the time. So just move more often. Let's get back on topic though. We were talking about how if you're hurt and you're having pain, that you should stop moving. You shouldn't. You might need to adapt your movement or slow it down, but in general, you should keep moving. If you have a strain of your rotator cuff, if you strained your hamstring, keep moving. If you've broken a bone, we need to stop moving, right? Bones don't heal if they keep moving. That fracture is moving and then it can't regrow and go through that whole process. So you need to get a cast on it. But a torn hamstring needs to move. It's just how much is it moving? What's the safe load? As a physical therapist, our first job is to help diagnose what's going on and show you what's your injury and what stage or how severe is it. And our second is to tell you what pain is safe. So if you've had a total knee surgery, then you're in a lot of pain and you're like, it hurts, so I'm not going to move because that means it's not safe, right? Pain and safety is something we correlate. But a certain amount of pain is actually okay and necessary in order for us to recover. Pain is just information, so make sure you're listening to your body instead of just avoiding movement out of fear. Thanks for sticking around. Wherever you're watching, make sure to follow for any of our future videos. And then if you've got any questions, make sure to throw them in the comments below. My favorite thing is to talk about things that you're interested to learn about. You're going to have specific questions about sciatica, back pain, headaches and migraines, whatever it is, you tell us so that we can make videos that are more specific to you.